You're my sunshine in the rain.
This week on Health Talk, we focus on alternative medicine, most commonly referred to in most cases as herbal treatment. But how effective is this, and how much can one benefit from this form of care? Well, Dr. Osman Satahu joins us now. Good morning and welcome.
Good morning. Thank you for being here.
Good morning.
Can you start us by kind of defining for us alternative medicine? When we say that, what exactly are we talking about?
Alternative medicine really carries a wider connotation than really meant saying herbal. But herbal is the oldest medicine that mentioned from, that most people knows. But alternative medicine takes in drugless modalities, or you call therapy. For instance, in ancient Egypt, massage the feet you call reflexology, where you can heal or get result. You send impulse or energy to the different organs of the body, and there you get some healing.
And that's alternative. I have to ask the Dr. Osman, the doctor part of your title, is it coming from an alternate, I don't know,
or would you go with the medic? Is it medical?
First of all,
are you
certified?
Let me explain. Yes, in United States, I am a naturopath, and naturopathic doctors, 16 states gives license to those who at least spend 4 years in medical school to become naturopathic physician. But we traditional doctors, we don't really do any form of obstetric or do any form of medical study. We just do practice all alternative modalities. And then we are well known all over the world, and we are mostly attached to churches, and we do other modality. We deal with, we use the aspect of religious counseling, psychotherapy. We do yoga. We can practice all 40 at least. I could mention right now that even the FDA, the American Drug Company, gives permission to practice in the United States.
You say this form of treatment is more effective than the conventional method, included surgery. What do you mean by that? You know, or explain to us how so?
First of all, to convince the public, I would just take for instance, this is a Harvard MD, and if he is saying that the alternative practitioner, which even some conventional MD practice, for instance, they are not the best to treat viral infection. They are not the best to cure most chronic degenerative disease. For instance, I went on the radio station and I showed the book. There's a cure for arthritis that they discovered in Sweden. How the people go to the spa and they spend years crippled, and they practice all the natural modality, including fasting, exercise, etc., and clean out the body system and use medicine, and they put away the prosthesis and become well, and they dance the Swedish dance to show how well they are.
Sorry, I'm just looking here, and I'm noticing it says a scientific breakthrough. When people think science, they think data, research,
doctors,
empirical,
certified
evidence. Is there scientific research or evidence to support these claims of alternative medicine, healing cancer and cardiovascular?
Yes, because here we are saying here, we practice alternative modality. We cure the most form of cancer. For instance, now, I am a homeopathic doctor, which they claim is alternative. Chiropractor is alternative. Osteopath who do 7-8 year medical school is alternative. So although they are alternative, they practice some of the conventional modality and the scientific approach. As a result of that, there are empirical evidence that they are getting results.
All right, Dr. Satahu, we're almost out of time, but very quickly, you say that your treatment can help with unleashing youthful energy, supporting your beauty, and increasing your sexual response.
What's that?
No, go ahead, sir.
We just finished the point on the cancer, empirical evidence.
Yeah, man, we'll finish that.
For instance,
we're talking about
your treatment.
Yes, for instance, now, the Queen Elizabeth and Prince Charles, if they have cancer, they would use this medicine. And they have medical doctors to use it.
What is that?
It's called carcinoma.
Made from?
Made from a carcinogen.
Natural.
So you're natural. So it's a form like antibiotics. The medical doctor will use the vaccine and they get the best result because they are good at the vaccine and cosmetic surgery, etc. But here the alternative doctor, even some of them would use this and then you get the cancer going remission.
So why isn't this more popular if it's such a surefire way?
Because it is cheap and effective, whereas allopathic conventional drugs is expensive and is not that effective.
He has a point because, I mean, a lot of us know that a lot of the conventional methods that we use are money-making schemes. You know, a lot of the drugs that we take have side effects and we'll buy drugs to, you know, counteract those side effects and the list goes on. Yeah. To doctors, though, who may dismiss this, you know, and say it's utter rubbish, what would you say to them?
So far, with this medication...
hold on, we want to know about the enhancing...
You want to hear about the sexual response?
Yes. Let me just finish this. I use this until the lady's cancer is in remission now 12 years. This with herbal medicine, right? That means to say, and the medical doctor is trying the lady and he wasn't getting any result until I applied this type of medication with some herbal medicine.
So therefore you need to go on a campaign for this because cancer is killing a lot of people more than any other disease.
Well, we'll come back to this, the other question, really sexual response then, so far. Because here alternative medicine would deal with what we call, in Indian medicine, we'll call them chakra.
What is that?
Endocrine. We usually call it endocrine. And for the first, the base and the second chakra, the reproduction. So when you are able to have effective or good sex life, you're open, you practice Tantra, that is Eastern philosophy, the real how love is to make. You will get good sexual response. You approach this thing from a professional point of view, as against the person who do it from an arrogant point of view and blow the chakra out of alignment and it become out of whack.
All right, like so for instance, they say men with diabetes has an impotent kind of problem.
Yes.
It has nothing to do with not being in love or not doing it right. He has a problem, blood flowing to the penis, all of this. What would you recommend for him?
Well, I would recommend that you start to energize the pancreas. First of all, we do detoxification. We clean it and we energize and start.
So first, wouldn't you need to get rid of the diabetes?
That's why I'm showing you.
Okay.
So one of the causes of diabetes is the lack of what we call chromium. So you start give that individual carrot, artichoke, right, whole wheat. Lots of other things like that. Then you start to practice some of the drugless modality like from the reflexology. Then you start to use some we call aphrodisiac. You know that. You start
give them two, you know.
Yes, give them the herbal thing.
No, what kind of aphrodisiac would they use?
Pear is an aphrodisiac.
Yeah, we have
chocolate.
Chocolate.
We have herbal.
Let's hear his.
Pardon?
What's yours?
She wants to know a list of aphrodisiac.
Aphrodisiac, we use what called ginseng is one.
Okay, but that's also something that's put together. That's not totally natural. It's
yes, but it's used natural
there's
medicine.
No natural aphrodisiac for.
Yeah, all right. I'm going to give it the most ancient one we use. We talk about the 5 rites from Tibet. In United States, I will demonstrate it when I'm giving. But you practice 5 rites 3 times a day, 9 times for 21 times a day, which takes in 20 minutes. 20.
What is that?
21.
What is that?
So you practice it for 7 hours.
What is 5?
The 5 rites is a Tibetan yoga technique.
Oh, it's an exercise.
And you're practicing, and by the time you reach 70 years, by practicing every day, you look like 35.
All right, so Dr. Sato,
you reduce your age, you have strength, vital, sexual, everything. It's very strong.
Dr. Sato, when someone comes to you with an issue, how do you test them first as a normal doctor would before you make your recommendations on what they should do?
Yes, we do the same prognosis and we study the same etiology and pathology, the cause of disease and treatment of disease.
Do you practice what you preach in the sense that do you do your exercises
and the 5 rites?
Your 5 rites and your herbs and stuff. Do you
most of the time, but it's hard to find the 21 to do the Tibetan rite to look very, very young, For instance, now, when you're 70, you're supposed to carry the age of 75, and our lifespan should be 144. So when the Bible says 10 is just half, you do.
Dr. Satahu, it sounds as if a lot of what you said, and I think you had mentioned before, is based on some very religious practices, so to speak. And if someone is of a different opinion, it could almost seem a little scary for them to involve in certain practices. How do you respond to that?
What would you say to ease that fear in a sense?
Well, I think education, you know, from the Latin word, bring them out from darkness into light, you know.
If somebody wanted to come to you, how could they find you?
Well, I advertise in the newspaper, and my picture is in the classified.
Right, well, you're
have a number now? You're here on TV
yes,
live?
my number is 955-7337.
Right.
That's 955-7337.
Yeah, and the cell number is 374-2403.
374-2403.
And is there a cost for your visit? I mean, do
consultation?
Yeah.
Cost?
Yes, but you know,
when them call?
When them call?
Yes, because you see, for instance, now to send cancer in remission, prostate cancer, with killing the men, now I use 3 months.